This segment is sponsored by Fairfax Radiology. While death rates are falling, we still want to make sure that you are informed. Guidelines on mammograms are constantly changing. So we sat down with Dr. Elise Berman from Fairfax Radiology Centers to talk about why it's important to get a mammogram. Dr. Berman, thank you so much for having us here. What is the guidelines now when it comes to mammogram? Who should be getting them? When should they be getting them?
That's a really excellent question because there has been some confusion and some conflicting information out there. So the societies and the organizations that have breast imaging experts on their panel recommend starting to get a mammogram at the age of 40 and having a mammogram every year after. And in fact, every society, including the United States Preventive Service Task Force, agrees that most lives are saved when mammograms start at the age of 40 and are performed every year thereafter.
We were also taught to do self-breast exams. So where does that fall in now with the guidelines?
So guidelines are sometimes changing, and it used to be that we would do self-exams every month. Now the recommendation is to know your breast. So what does that mean? Know what's normal for you, how your breast changes throughout the month. If you notice something that's different, a lump or a thickening or a change in your skin or something under your arm, you should let your doctor know about that.
Okay, and when it comes to a mammogram, I know some women can be fearful of them, but they save lives and they're super important. So what can somebody expect when they come in for a mammogram? Does it hurt?
So that's a really good question. And when we do a mammogram, we really need to put the breast into a little bit of compression because that gives us the best picture. And generally, it's really well tolerated. Most people don't have too much of a problem with that. Some people do have some mild discomfort, and really some people might have a little bit of pain. The important thing to know is that it's really critical to have that compression for a good mammogram. You can let the technologist know she's specially trained to work with you, and the compression lasts for just seconds, and then as soon as the picture is taken, the compression will let up and it goes away.
So just a few seconds could save lives because early detection is obviously of the utmost importance.
Exactly.
Okay, and so when it comes to mammograms, is it important where somebody goes to get their mammogram?
I think that's one of the most important questions that you can ask before you get your mammogram. And the answer is yes, because all mammograms are not the same. So we've seen and we know that who interprets your mammogram is important. People who have special training, who do a lot of breast imaging, tend to have better cancer detection rates. So it's very important to know, is the facility that you're going to affiliated with, or are they a breast imaging center of excellence? That's a special accreditation by the American College of Radiology. And who are the doctors at that practice, at that facility, who are reading the mammograms? Is it people who do spine x-rays and brain CTs, or is it people who spend all their time every day working with breast patients?
And that's what you all do here. I mean, that is the sole focus.
Exactly. So I'm really fortunate because I have 19 colleagues here, and all we do all day, every day, is breast, from screening to diagnosis to biopsy. And it's really a very special place to work with people who care so much about these patients.
What are the other hard questions that your patient should be asking?
I think a good question is, what does it mean if I'm called back after a screening mammogram? And if you are called back after a screening mammogram, it means we need some more information. So you'll come back, we'll do some extra pictures, we might do an ultrasound, and we'll be able to give you the results of that study immediately.
And then how does it work here with guiding the patient through from checking in to getting the mammogram?
So we want to make sure that you have the most comfortable experience. And so when you have your mammogram, if it's a diagnostic mammogram, the radiologist is looking at it as you're having your mammogram being performed. If it's a diagnostic mammogram, we give you the results immediately after the study is over. If it's a screening mammogram, you're in and out in 15, 20 minutes, and you get your results very quickly thereafter.
Wow, so if coming in for a diagnostic, you get your results and there isn't that waiting period.
Exactly. Okay. We'll do everything that you need before you go. And if you are one of those few people who need a biopsy, we will help you. We will take care of you. We'll get you scheduled for that procedure. We will let your doctor know about it. You don't have to worry about any of that part of it.
Well, Doc, thank you so much. It's such important work, and we appreciate you sharing all of this with us today.
It's been my pleasure. Thank you so much.
To schedule a mammogram online, just go to fairfaxradiology.com, or you can call to make an appointment. The number is 703-485-9628.